You're never told that life could ever get this way. When I was researching what other breast cancer survivors and Pink Sisters have to say about mentally preparing for a mammogram and potential biopsy, I didn't find much. There were a few things. Mostly what I saw were clinical perspectives, and they have no clue what it's like for us as patients to experience a biopsy. So this is why I'm sharing this video, because I think it's important for us to know how to both physically and mentally prepare for a mammogram and a potential biopsy. First, I want to talk about mentally preparing for a mammogram, because there can be different outcomes from a mammogram. How prepared we are for a mammogram can depend on if we're prepared for all possible scenarios. Our care providers can't really tell us how to mentally prepare for an imaging appointment unless they themselves have also had to endure the possible scenarios of how an imaging appointment can unfold, they themselves as a patient. If you're a survivor, I'm sure you have a lot of thoughts of what you would share about how your imaging appointment unfolded for you as a patient. Now, it's normal to go to a typical breast imaging appointment and not expect a mammogram. Usually only about 10% of mammograms end up coming back as abnormal. It's also normal not to expect to have a biopsy performed at a routine mammogram or imaging appointment or any kind of mammogram or imaging appointment. Only 1 to 2% of those who have an abnormal mammogram will actually need to have a biopsy. If you don't take anything else away from this video, note this. You should go to your mammogram, not expecting for anything to be abnormal and not expecting to have a biopsy. But you should be mentally prepared for the possibility of any worst case scenario. The percentage of those who found a spot on their own and not through a mammogram probably depends on your age. 71% of women under the age of 50 found a spot on their own by themselves. So they, including me, you would think they would be a little more mentally prepared for the possibility that they might have a biopsy on the same day as their scheduled mammogram. About 36% of women over the age of 50 found a suspicious spot on self-exam, and you would think that they also would probably be just a tiny bit mentally prepared for the possibility of having a biopsy on the same day as their scheduled mammogram. Those whose cancer was found on mammogram may have simply thought that when they went to that imaging appointment that they were just going to have a simple mammogram, no biopsies. They'd probably reschedule those, right? Regardless of if we found the suspicious spot on our own or it was detected through a mammogram, it's still nice to be just a little bit mentally prepared for the possibility of a biopsy on that same day of that imaging appointment. It helps us control our comfort levels a little bit better if we're prepared for what to expect. Now, I'm not saying that you're going to have a biopsy at your imaging appointment. I just want to share this information for the possibility that you might have a biopsy at your imaging appointment. Most people don't have a biopsy at their imaging appointment, but it could happen. And I don't want you to be taken off guard, to be blindsided by them saying they want a biopsy that same day. Just be mentally prepared for the possibility that it could happen. It happened to me. I was not expecting to have a biopsy at that imaging appointment after I found a suspicious spot on my own. And both myself and my general practitioner wanted imaging, but I didn't expect there to be two things going on at that appointment, both a mammogram, an ultrasound, and a biopsy. I thought the biopsy would be on another day. I think our brains do something to protect us so that we don't just totally freak out when we have an imaging appointment. Our brains sometimes think that we would not have a biopsy on the same day as a mammogram, even if we already know there's a suspicious spot there. I personally thought I had a clogged milk duct, calcification, not cancer. And maybe all three of those scenarios require a biopsy. I'm not a radiologist, so I don't know. I'm just here to share my experience with a mammogram and a biopsy that occurred on the same day. I'm not a medical professional at all, but I do want to help you mentally prepare for the possibility that you will have a biopsy on that same day so that you can control your comfort levels. My last mammogram before this one was pretty uneventful, so I expected this one to be pretty uneventful as well. I think that my brain was mentally disassociating to protect myself. Disassociating is defined as a mental process of disconnecting from one's thoughts and feelings. I knew something was off this time at this mammogram that I had because the spot didn't go away. It got bigger. My spot was itchier. The nipple pulled away more. There were veins that were starting to protrude from it that weren't there before. So you would think that I would be mentally prepared for the possibility of a biopsy on the same day, but I was not. I was in denial. My mother-in-law told me that she had a spot that was removed on her breast and that it was simply a calcified milk duct. So my brain decided, that's me, that's my issue. She still had to have a biopsy herself, but my brain was not going there. You may be thinking, well, Christine, you should have known that you were going to have a biopsy at some point with this. I didn't expect the biopsy to be that day, the same day as I was expecting them to be separate appointments. So imagine my surprise when I was told I needed to have that biopsy as soon as possible. They did say that I could reschedule it, but they kept emphasizing I needed it done soon. Also, they told me, I believe, that if I rescheduled for that biopsy, that it would be extra charge because they're two separate appointments then. This is why I'm making this video, because I want to help you be mentally prepared for the possible scenario of a biopsy being performed on the same day as your imaging appointment. You never know. There are things that I think make a biopsy a better experience if we're mentally prepared for one as a patient. I want to talk to you about how to be both mentally and physically prepared for an imaging appointment in all possible scenarios. And so I'm going to talk about how to prepare for that imaging appointment, what to expect during the imaging appointment, and how to take care of yourself a little bit after that imaging appointment if you end up having a biopsy. Before you go to your imaging appointment, make sure that you take a good bath or shower the night before, actually 24 hours before your imaging appointment, because one, you have to have that area dry for about 24 hours before your imaging appointment for some reason. And also, if you do have a biopsy, that area needs to remain dry for up to 2 days, for 48 hours. So you're not going to be able to take a shower or bath after a biopsy for 2 days. Let me clarify. You can still take a shower after that first day following a biopsy, but you still have to take precautions to keep the area that was biopsied dry for 2 days. Now, while I say that you need to take a good bath or shower Don't start piling on any perfume or lotion or deodorant after this particular bath or shower in preparing for that imaging appointment, because those things can interfere with the imaging. Make sure that if you have any chores to do that require any particular lifting or lots of activity, that you do them before this imaging appointment, because if you have a biopsy, you're not supposed to lift heavy things or even remotely heavy things for a while. You need to let that area heal. And also be prepared that after that biopsy, if you have a biopsy, that you shouldn't be too active, because you're going to have to focus on healing from it. Don't get me wrong, the biopsy isn't that bad, but you need to allow your body to recover from it, and any potential heavy lifting and lots of activity are a no-no in that healing process. I know it's really hard for some of us to take it easy. We're always going, taking care of everybody else but ourselves. But seriously, you need to be prepared to take it easy after this imaging appointment in case you do have a biopsy. So if your job requires you to do any heavy lifting, I suggest that you prepare to take that day off. Maybe schedule the imaging appointment for the afternoon if possible, but also maybe schedule it for a Friday so that you can heal over the weekend if you aren't working on the weekends. I know that a lot of postal employees they have to be able to lift up to 75 pounds. I know it doesn't happen very often because I was a postal employee for a while, and usually when you're sorting, chances of having a 75-pound package, it doesn't happen very often, but it might. So maybe take off that Saturday if you have to work Saturdays too. Take off the whole weekend. Schedule that appointment maybe for a Friday if possible, and Friday afternoon if possible. And take the whole weekend off so that your body can heal over the weekend in case you do have a biopsy. Another reason to set off a big block of time, not like having a surgery, like inpatient or hospital surgery, but a biopsy. If you have a biopsy, it may take 1 hour to 1.5 hours to have that done. It's not because the biopsy itself takes that long, but they have to set up for the biopsy, and that can take time. So even if it's just an imaging appointment, there might be the possibility, it's very low, but there might be the possibility of a biopsy being performed at that appointment. So I would take the day off or take the afternoon off. Don't schedule it for the morning thinking you're going to come back, and I'll talk about that in a few minutes. Be prepared to go home afterward and not be doing a lot. Now, everyone is different, but for me, the mental and physical exhaustion after a biopsy made me want to just go home and rest for the rest of the day. You may want to relax for the rest of the day, and that's another reason that I tell you to just make this a time to take care of yourself and just relax for the rest of the day. So what should you wear to this imaging appointment? Well, what I'm wearing right now is probably a good thing if it's winter time, but something loose, something dark, something that's not tight. Also, you will have to wear a sports bra or some kind of bra that does not have underwire. It needs to be tight on your breasts, but not be underwire. You want compression, but not underwire. Also, arrange for someone to take you to the appointment and bring you home just in case you do have a biopsy. I'm going to talk a little bit more about what that person can do for you, but have them there just in case, if for nothing else than just to be there to help encourage you and help distract you, help keep you from having so much anxiety. But they may need to be there to take you home after this appointment if you do have a biopsy. Unless this is a surgical biopsy, and it's not going to be a surgical biopsy in the case that I'm talking about, because I'm talking about you going into your imaging appointment and potentially having a biopsy the same day. So you can eat and drink the day before just like normal. Only in cases of going under or in cases of blood work do you need to be careful about not eating or drinking at a certain time the day before. Go ahead and eat and drink the day before your imaging appointment. Needle shy, if you don't like looking at needles, I would suggest that you ask the staff to not put the tray of equipment and tray of tools that they use for the biopsy where you can see them. Out of sight, out of mind, right? In hindsight, if I knew I was going to have a biopsy during that imaging appointment, I would have asked to have it booked with the place that if it did end up being cancerous, it would be the same place that would be giving me my medical treatment. You might ask why. Well, I had to have an additional biopsy with MD Anderson because they prefer to do everything in-house. So I had to have a biopsy again for the same thing, just to make sure that they got it done right and they knew what they were looking at. So maybe ask, if you live near MD Anderson, for example, ask for that imaging appointment to be booked at a place where if it ends up being cancerous, it's going to be the same place that provides your medical treatment. Though an imaging appointment can sound scary, most clinics do try to make you as comfortable as possible. All of my memories of going into an imaging appointment are positive with the spa-like experience that they give. I always was provided with a warm robe and a warm blanket. If it's not provided, most likely it's because maybe the warming equipment is down for some reason, but I never had that issue. They do provide you with a robe and a blanket, whether it's warmed or not, but it's usually a really spa-like experience. At the MD Anderson clinic, they even had the trickling water fountains in that waiting room that's after the public waiting room. It's for just the patients. They had a really spa-like experience with the trickling water fountain. I think they had coffee and tea and hot cocoa available, and graham crackers and regular crackers available. In another video, I might talk about why they sometimes have snacks available. But it's a very spa-like experience. When you go into the actual room where they're going to perform the biopsy, it's nice and dark, not completely dark. It's a spa-like dark. It's low lighting. Sometimes they have very faint spa-like music going on. They really do want to help you relax as much as possible. So I wanted to let you know that, so that it might help calm your nerves if you're thinking, well, I don't want a biopsy at the same appointment. They do usually go out of their way to help you relax. Now, the type of biopsy that I'm trying to help you mentally prepare for in this particular video is most likely going to be a core needle biopsy or a fine needle aspiration biopsy. The other biopsies require you to have a separate appointment set up, so I'm not talking about those today. Most nurses and staff in the imaging department are really great people. They're hired because they are compassionate. The person there at my biopsy, at my imaging appointment that resulted in a biopsy, was a very nice person. She let me hold her hand when I was anxious, and when I was also anticipating what I'm going to talk about next. She let me hold her hand to ease that anxiety. But this is another reason that I strongly suggest that you have somebody take you to your appointment. Now, not all clinics are the same, but some clinics will let that person go back with you to that biopsy. Ask. It never hurts to ask. Now, my husband was not with me at that first appointment, but he was with me at all other appointments where I could potentially have a biopsy, and it made a huge difference because I was able to hold his hand as tightly as I needed to. And believe me, there have been times I have held his hand tight. The birth of all three of our children and these biopsies are the times when I held his hand really tight. He helped distract me from the noise that comes with this biopsy. They will warn you that there's going to be a clicking noise. And some people are fine with that when they're warned. In fact, the radiologist at my first appointment counted, and then I knew when that biopsy was going to have that clicking noise. But I'm not as talented as other people with anticipating that clicking noise. I was kind of like Buddy the Elf. Think about Buddy the Elf from the Elf movie when he was QCing or quality controlling the Jack in the Boxes. He knew that that little Jack in the Box was going to pop up, but every time it popped up, he jumped. That was me. So my husband was there at subsequent biopsies so that I would not hear the clicking noise. If you cannot bring somebody with you, or just to prepare in case they won't let that person go back with you, I suggest that you bring a stress ball so that you don't have to worry about holding somebody's hand. And also, if they let you, bring some earbuds and play some good music, not music that you're gonna dance to, just relaxing music that can what's the word? Sorry, I have some brain fog. That can distract you from that clicking noise that is loud enough that you don't hear it, or it's faint. You might ask if you're going to be in pain after this appointment, and I can't answer that for you because everybody's pain threshold is different from person to person. Some people had a little bit of pain, but it went away quickly. Some people had pain, but it lasted for a few hours. Some people, it took them a couple days to recover from this. So I can't tell you what you're going to experience personally for yourself with the pain threshold. The type of biopsies I'm talking about you being mentally prepared for here are most likely going to be core needle biopsies. They could be fine needle aspiration biopsies, but the nice thing about this is that both of those, they use a local anesthetic to prepare you for that biopsy. It's very similar to going to the dentist. They give you lidocaine or Novocaine, and they're going to do that to numb that local area. Now, if you're the type that needs a lot of that numbing medication to not feel the sensations of the procedure that's going to follow, make sure to let the staff know so that they can give you more than normal so that your experience is more comfortable, because they don't know your pain threshold. They're not inside your body. You need to speak up and let them know, and then most likely you will have a more calming, more comfortable experience, not as uncomfortable. I'm not gonna lie, it probably will hurt a little, but they do clean the skin and they numb the site. I think the most painful part of a biopsy is the numbing step, because it will sting a little, it will pinch and sting a little. Breathe through it. That's what I did, at least. I breathed through it. It helped a lot to have my husband at the subsequent biopsies. That's why if you can't have somebody back there, plan to have some music and earbuds if they'll let you do that. Remember, I said this is what hurt the most. There will be some pressure in the procedure, but it should not hurt after you have been numbed. Chances are these two type of biopsies I'm helping you mentally prepare for will be ultrasound guided biopsies, but ask just in case, because ultrasound guided biopsies have more accuracy than biopsies that are not performed with ultrasound guidance. Biopsies that are performed without ultrasound guidance are only about 26% accurate because they may miss the target site a little bit by not having that ultrasound guidance. On the other hand, ultrasound guided biopsies are around 98% accurate in comparison to biopsies that aren't guided by ultrasound. Just to give you a heads up, they also may position you with wedges and pillows to help give them access to the site that they need to look at better. During that biopsy, they are going to leave a clip behind. It's to communicate to themselves and possible future radiologists that a biopsy was performed there. The clip they leave behind is a small little sliver of a clip that can be seen on imaging, but hopefully you're not going to be too alarmed. It shouldn't set off alarms at the airport or things like that. It's just a tiny little clip that they leave behind to communicate to themselves and any future radiologists that a biopsy was performed there. You're probably going to think this is insane because they did a mammogram at the beginning of the imaging appointment, but they may ask you to go in and do a mammogram after the biopsy. I know, I thought it was crazy, but it's going to be a different type of mammogram than the one prior to the biopsy. They try their best to make it as comfortable as possible. I know that sounds weird because you still have to have your boob flattened like a pancake, but they aim to have very low compression on this subsequent mammogram, and the mammogram the purpose of this second or subsequent mammogram is different than the first one. It's to make sure that that clip was placed correctly and that they did everything they needed to do at that biopsy. And complying with this helps ensure that you don't have to go back for another imaging appointment. Maybe it might help alleviate the need for subsequent imaging. You never know, but they're trying to make sure they did the best job possible. I did not have any stitches after the biopsy, and those breast cancer survivors and Pink Sisters that I did research, they also did not have any stitches after this biopsy. They put Steri-strips on you, and those fall off on their own usually. Chances are that you're going to be a little overwhelmed after this biopsy just because of what you just went through. So they should give you both written instructions and verbal instructions on how to care for yourself after this biopsy. If they don't give you written instructions, speak up and ask for them. Most clinics will give you written instructions, and I think they should. Even outside of the experience of a biopsy, I'm the type of person that's visual. When you tell me instructions verbally, I'll remember them for about 30 seconds, and then I need to have it written down somewhere. I want to make sure I don't forget anything. I even have notes right now. I have to have visual instructions in addition to verbal instructions, and most clinics know that everybody wants to have those written instructions just in case. After your appointment, make sure to have access to some pain relievers. Make sure that the oral, like the pill type pain reliever, is Tylenol and not any type of pain reliever that could thin your blood. Also, somebody suggested arnica oil. My husband uses this for his back pain, and it works really well. They'll most likely send you home with the ice pack, and it's good to keep that ice pack on every 20 minutes or so until the pain subsides. If you notice anything that is off about that site after your biopsy, make sure to let the radiologists in your care team know. Anything like pus, redness, or swelling, anything that's off, a temperature there, let them know in case there might be an infection, and they can help you stay on top of it. It's been a while since I had the biopsy that I'm talking about, but I do recall having some nausea, and some of the other people that shared their experience with the biopsy said the same thing. So you may be a little bit nauseous afterwards, which is another reason to block off time just in case you have a biopsy at this imaging appointment. And it's another reason to prepare for taking it easy after the appointment. Only about 1/4 of biopsies result in a breast cancer diagnosis. So after your biopsy, I want you to really try to get your mind off of the outcome of this biopsy. So maybe ahead of the biopsy appointment, in preparation for afterwards, prepare to binge watch a series that you've been wanting to watch, or one that you love, like Friends. I like Friends. I probably would binge watch that. Prepare to binge watch something, or to watch a movie you've been wanting to watch, or one that you love and want to rewatch. Read a really good book, something to help you take your mind off of what may or may not come next. I really hope you don't spend time anxious and worrying over what's going to happen next. Take this one day at a time. Breathe. Breathe in. Breathe out. Do that as often as you have to calm your nerves. And take this one day at a time. If you want to get your results more quickly, I suggest that you literally ask the radiologists to let you know what the results are as soon as they have them. It's actually their job to do that. It's not just their job to get the imaging done and to interpret it. It's their job to let you know and help you figure out what they found, because their terminology is not what you're used to. It's their job to translate that for you in what you can understand as a patient. Whatever you do, I hope and pray that you do not go onto Google and try to decipher anything that you find on my chart before you talk to the radiologists themselves. Don't Google it. Please don't Google it. It's their job to decipher this information for you, to translate this information for you. I don't want your mind to go to worst case scenarios in the outcome of your biopsy without talking to them first. They can, if it is bad information, they can help you walk through it. Nowadays, usually the information from your biopsy shows up on your MyChart or something similar. It's a digital chart that you can go to access your information. Make sure that you do get a copy of the biopsy results. It helps with a baseline for future mammograms, future breast imaging. It helps for potential future situations to have this information. Now, don't go by what I say if it's different than the written instructions that the radiologist gives you. But you can usually take off the outer bandage of your biopsy a few hours after it's performed, but don't take off the stair strips. Those should come off on their own. If the stair strips don't come off after 7 days, ask first, but usually they will tell you that you can take them off. Breathe. Breathe in. Breathe out. Do that as often as you have to calm your nerves. And take this one day at a time. You're not alone. And if you feel alone, you're certainly welcome to join my breast cancer support group. My breast cancer support group is on Facebook. I will put a picture of it here in this slide. It is Pink Warrior Calendar Girls Support Group. I'll also put a link in the description of this video. I just want to make sure that you really know that you are not alone. You do not have to go through this alone. We are here for you.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life's still wait. This journey feels like you're in second gear.